Hello, my name is Angela Phelps, and this is going to be my video on doing injections. First thing I'm going to do is I'm going to check my physician's order, and I'm going to gather my supplies. Then I'm going to grab my MAR, and I'm going to do my 9 rights of administration. That's going to be right patient, right medication, right route, right dose, right time. I'm going to do that times 3. Then I'm going to do right reason, documentation, response, and the right to refuse. After I've done that, if there's any dosage calculations that need to be done, I'm going to do that. And then I'm going to go to the room. I'm going to explain the procedure to the patient, introduce myself. I'm going to check their armband for date of birth, any allergies, and their name. And then I'm going to provide privacy. I'm going to physically lock the bed, and I'm going to make sure that the side rail and the bed is up to a comfortable, safe, and working position, not only for the patient, but for myself as well. Then I'm going to go over here, wash my hands, put my gloves on, and I'm going to make sure that the cap to my needle is on a clean surface. That is it for the general procedure. All right, the first injection that I'm going to be doing is a sub-Q injection of insulin. I'm going to make sure that I have the correct medication. I've checked it for the right dosage, the right route. I've checked the expiration date. I've checked to make sure the clarity is right. I've also checked to see when it was opened. The next thing I'm going to do is I'm going to bring it to the MAR, and I'm going to check. It's Novolin in, Novolin in, Novolin in. I've checked to make sure the patient, I've checked for signs and symptoms of hypo and hyperglycemia. I've checked the MAR to make sure it is the right time. I've wrote my blood sugar in here, 197. I have checked the site, the last site that it was given, which is in the left upper arm. And I also have another nurse that is going to witness what it is that I'm about to do, how much insulin I'm about to give. So again, I'm giving Novolin in, and I'm supposed to be giving 12 units sub-Q this morning. So I've already washed my hands. First thing I'm going to do is I'm going to put my gloves on. Well, I really don't have to put the gloves on to do this. So I'm going to take the top off. I'm going to make sure that I have the correct syringe for what it is I'm about to do. It is an insulin syringe. It's a 100-unit insulin syringe. I've checked the dexterity of the package to make sure that it has not been tampered with and it is not expired. So I'm going to now clean my top. I'm going to make sure that I do not touch it. I'm going to clean it from the inside out, or in just a circular motion. Now I'm going to open my syringe. And I'm going to make sure this needle is very tight. I'm going to pull this up and down to loosen it up a little bit. And now I'm going to instill 12 units of air in, because that's what I'm taking out. I'm going to remove my cap and place it back in there on a clean surface. I'm instilling the 12 units, flipping it up, holding it, looking, checking to make sure I don't have any air bubbles. I do not see any air bubbles at this time. Now I am removing it, putting it back down. Now I'm going to take this cap, put it there, and I'm going to do the 1 swoop method. And now I have my cap. I'm placing it back in here. So that is ready for me to take it into the room when I go in the room. So there's 2 methods to give an insulin. We've got the first method is the 45-degree angle method. That is usually used on thin patients. Then we have the 90-degree method, which is usually used on obese patients. I'm going to be using the 90-degree method. I'm going to check my MAR again, make sure I have everything right. Right patient, right route, right time. Right site was the left upper arm, and I'm going to be using the abdomen because the last site was the abdomen. Now I'm going to put my gloves on. My gloves are on. I've explained to the patient what it is I'm about to do. I'm using the umbilicus, and it is at a 90-degree angle. I'm going to clean it. I can now remove my needle. 2 inches from the umbilicus. Pinch it, clean out. Hold it. 90 degree. Don't have to aspirate, it's insulin. Come straight up. I'm going to activate the safety lock. I'm going to put it in the sharps container. I'm going to take my gloves off. I'm going to wash my hands. I'm going to document the procedure, and then I'm going to make sure that the patient, the bed is unlocked, the call light is within reach, and the patient is comfortable. That is it for a sub-Q injection. It's going to be an eye injection. First thing I'm going to do is I'm going to grab my medication. I'm going to make sure that I have the right medication. It's the right route. It is the right dose. It is not expired when it was opened. I have already checked it against my MAR. I'm giving Toradol. I can give 30 milligrams IM every 6 hours. I've checked my MAR to make sure that it has not been signed off for, and it has not been signed off for. The patient is in pain. Next thing I've done is I've grabbed my syringe. I've checked to make sure it is the correct syringe. It is a 23 gauge, 1 inch, and that is appropriate for what it is I'm about to do. I've checked to make sure that there are it's not contaminated or opened. It's fine. I've already washed my hands. Now I'm going to clean my vial inside out. And I'm going to open my package. Now, when I open this package, I'm going to make sure these needles, you got to make sure that it is actually attached to it. So I'm going to grab it right here, and I'm going to make sure the screw on it is. I'm going to do my plunger, make sure that that is right. I've already cleaned my top. Now I'm going to move my needle. I'm going to inject my air. I'm going to flip it over backwards. And I'm going to pull out my dosage. I'm looking to make sure that there aren't any air bubbles. If there are, I'm going to gently tap it until I have them all removed. Once I have what I need, I'm going to put it down. And now I'm going to recap this. Put it down. Now we're ready to go into the room. I've already looked at my MAR again. Make sure I have the right medication. It's the right dose. It's the right route. Now I'm going to put my gloves on. I'm going to explain my procedure to the patient again. I'm going in the right deltoid muscle, so I have to do my 3 fingers. It'll be the third, touch the chromium process, 3 fingers down, and then I'm going to touch it like that. So I've done that. All right. 3 fingers down, the chromium process, clean outwards. 90 degree angle, straight down. Aspirate. I don't see any blood. And inject. Do not massage the area, coming straight out. I'm going to activate my safety lock. I'm going to put it in the sharps container. I'm going to remove my gloves. I'm going to wash my hands. I'm going to document it on the MAR, the time, the site where I gave it at. I'm going to make sure that the patient is in a comfortable position. Call light was in reach, and the bed is in the correct, side rails in the bed are in the correct position. And that is it for IM injection. Injection is going to be an intradermal injection. And I've looked at my medication. It is the TB solution. I've checked it for the right medication 3 times. I made sure it is the right med, it's the right route, it is the right dose, it is not expired, and the date it was open. I've also checked the lot number, the manufacturer, and the expiration date. I'm going to have to put all of that on my MAR after I'm done. So I've washed my hands. I've got my the correct syringe. This is a 1 ml TB syringe that I have, and I've got my alcohol swabs, and I've got my site. So I've check the right site that I'm going to give it at. I've got my site. It's going to be in my left forearm. I'm going to clean my vial first, making sure I don't touch that from the inside out. Now I've checked my package to make sure it's not expired. It hasn't been tampered with. It is the correct syringe. As with all my other ones, I'm going to make sure that I have a clean package. I'm going to, the dose says to do 0.1. I'm going to make sure that this is nice and smooth. So I'm going to inject 0.1. And I'm going to put that there because I'm going to need it. Already cleaned. I'll make sure that there are no bubbles in there. Good to go. I'm going to one cap this back. And now I'm ready to go into the room with my patient and give my injection. So I've already washed my hands. I'm going to put my gloves on. I've checked my site. I'm going to do intradermal. Check my site. I'm going to clean my site. I'm going to make sure that I go in at a 5 to 15 degree angle with my bleb side up, making sure I don't go no further than 1 inch in. Bleb side up. Up. Okay, good. Now I'm going to inject my medication, holding my skin tight. I am now making a bleb. Okay, bleb is done. Now I'm going to activate the safety lock. I'm going to put that in my sharps container. I'm not going to massage that. I'm going to circle it, date it, and time when I gave it. I'm going to go back to the MAR, also document all the information on the MAR. Remove my gloves, wash my hands, make sure that the patient is in a comfortable and safe position, and call light is within reach. And that is it for intradermal.
So how inserting the needle? What's the maximum depth that you
1/8.
Okay, I just had to say that because you said 1 inch, so we clarified that, right?
Right.
1/8.
1/8.
Okay.